A good Saturday morning to everyone tuned in to VOB 92.9 FM. You made the right choice at the right time, as it's time for 15 diabetic friendly minutes, all with the compliments of the Barbados Diabetes Foundation.
Oh, it's not listening? Then I hear what's happening in today's show.
Fair enough. Let's hear what's happening in today's show.
And keeping both the menopause symptoms and diabetes in check will help you to feel a lot better.
Hear what Nurse Tracy has to say about the impact of menopause on diabetes.
So if you have the very early stages of diabetic retinopathy, what we would say is mild diabetic retinopathy, then it's possible to reverse it.
Hear Dr. Charles Pierce on if diabetic retinopathy can be reversed.
They sound interesting. I can listen.
All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Ice Screening Program, and the bank that can reverse your bad situation and make your financial dreams come true. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren St. Michael. They can save your life and save you money, but members get 10% off.
Good morning to everybody again. This is Peter Boyce again, and you might be tired hearing me on the radio so much times that you might be saying,
I'd be tired hearing Peter Boyce on the radio, no. He's getting me so sick.
but if you are diabetic or pre-diabetic, if you start to feel sick, the Maria Holder Diabetes Center in Warren St. Michael is your one-stop shop for all of your diabetic services. You don't have to go all over the place like a Yahoo or like Polka Donkey looking for this service and that service. You can find podiatrist Louise Robinson there to take care of your feet. You're going to be hearing from Louise later in this show. They also have vascular screening. And you know about vascular screening, right? If you feel you might have bad circulation, this is a service that you should be looking to book. You might be home saying,
I would really like to get one of them vascular screenings, but I ain't diabetic.
well, you don't have to be. There are many health check services that can be used by persons who aren't diabetic that you can find at the Maria Holder Diabetes Center, like this same vascular screening here.
A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937.
So just call and get more information. And then there's eye screening for diabetic retinopathy. This is something that all diabetics should be doing once a year. But you might be diabetic and you might be home listening to VOB and you might be wondering,
Can diabetic retinopathy be cured?
so let's get a response from a medical professional. We go to clinical lead of the Barbados Diabetic Eye Screening Program, Dr. Charles Pierce, to answer the question if diabetic retinopathy can be cured.
That's a very good question. So if you are able to control your diabetes and potentially actually even reverse your diabetes, then diabetic retinopathy to an extent can be reversed. So if you have the very early stages of diabetic retinopathy, what we would say is mild diabetic retinopathy, then it's possible to reverse it to the stage where you have no visible diabetic retinopathy. But if you do have significant diabetic eye changes, then it's unlikely that you're able to cure it, and you'd have to continue with monitoring or treatment.
If a person becomes blind from diabetic retinopathy, if they were to start treatment, can the condition be reversed?
Unfortunately, that is unlikely if you're completely blind, as in you're not able to see any light or very minimal amount of light, something we call as no perception of light or only perception of light. In that case, it's unlikely that you're able to reverse that. However, if there are a lot of changes from diabetic eye disease and you have the appropriate treatment, then there can be some improvement in your vision. But it all depends on how advanced the changes are.
So this underscores that it is important that persons really keep on top of getting their eyes screened.
Absolutely. So what we're trying to do is pick up these changes before they get to the stage where you have significant loss of vision. You want to have the screening done, and if there are any signs of early diabetic eye disease, then we can intervene at that point and make a significant difference to preventing you to go on to have loss of vision.
Dr. Charles Pierce has spoken, and I hope you have been listening. So call this number now coming up and make that eye screening appointment for diabetic retinopathy.
243-3937. The Maria Holder Diabetes Center.
The next topic that we will be highlighting this morning is a topic that will be especially of interest to the ladies: the impact of menopause on diabetes. So I am going to let this next health professional introduce themselves.
Hello, my name's Tracy. I'm the diabetes specialist nurse here at the Diabetes Centre in Warrens. I want to talk to you about something many women experience but few of us want to talk about, and how it affects your diabetes as well, and that's the menopause. It's a natural phase that occurs in women's life, but it can bring with it many changes, not just to your hormones, but how your body manages your blood sugar as well. During the menopause, the two hormones, estrogen and progesterone, fluctuate and eventually decline. These changes can make your blood sugar levels more unpredictable, and some people may notice that their blood sugars run higher, particularly overnight or after meals. Some of the side effects, or symptoms I should say, that you experience with the menopause are things like weight gain, trouble sleeping, increased insulin resistance, which is obviously going to affect your diabetes, and it can also make managing everything feel more difficult. Other things could be things like irritability, and which also will affect your family and friends and loved ones. So what can you do? Key thing is to make sure that you manage your blood sugars more closely if you're noticing changes in your blood sugar profile. Keep a log and note any patterns and changes as mentioned, and make sure that you contact your healthcare team to provide the support that you need and to help you to make any changes that are necessary. Obviously, focusing on lifestyle habits will help with some of the symptoms and your diabetes, of course, meaning a balanced diet, even something simple as walking or any other exercise that you're able to do, managing stress levels along the way, and keeping both the menopause symptoms and diabetes in check will help you to feel a lot better. Lastly, be kind to yourself, because life is full of transitions, but you're not alone, and we're here to support you. And the key thing is to make sure that you contact your doctor or healthcare provider to provide you with that support and any changes that might need to be made. If you have any concerns, please don't hesitate to reach out to us, and let's keep the conversation going, because women's health matters, and so does your journey with diabetes. Thank you, and take care, all of you.
Thank you, Nurse Tracy, for that segment focusing on women's health as we move into our Saturday song of the day. And it's a crossover one, so we're going to start dancing now, people. If you get hot flashes, you're still the hot gal of the year. This is Starter Pack by Tiana Hernandez. Compliments the Maria Holder Diabetes Center and Republic Bank.
Show me what you can do. Send the body, send the crew. Show me what you can do. Hey, girl, you're too soft. Bend your back and you don't look back. Tell me what's in your salt of fat. I want to rock up the waist, let's put that down and bend down and shake it, shake it. Bend your back, don't break it. Girl, bend down and show them who's the hot girl of the year. Girl, bend down and shake it, shake it, shake it, shake it. Raise your flag and show them who's the hot girl of the year.
Women's health matters, and so does your journey with diabetes.
Maria Holder Diabetes Center.
Show me how to do that. Make the bumper clap. Show me how to do that. Make it
Holder Diabetes Center.
Another service which is available at the Maria Holder Diabetes Center is podiatrist Louise Robinson, and she is there to look after any foot issue which you might have, so you should call and make an appointment. But you might be wondering what you can do for yourself when you are at home to check your feet. So let's hear from Louise Robinson on that.
Check your feet daily, and what you're looking for is look between the toes. Make sure you dry between the toes. Don't let the skin get wet from sweat. Wash your feet every day. So important. Keep hygiene. Moisturize your feet, but never in between the toes. But moisturize the bottom of your feet, because that is skin also. So keep your skin intact, and please don't walk around barefoot. Just put something on your feet, because if you get anything stuck in the foot, you will probably, as a diabetic, will not know about it until it's too late. And sadly, we're seeing far too much of that. That's why you should come and get your feet and toenails cut by us. So I'm here at the Diabetic Centre at the Maria Holder Centre at Warren. Reach out to us. I can do a foot care assessment, footwear assessment, look at orthotics and inserts, talk about general education, how to not lose your toes and what to look out for, and prevent a condition people have heard of, osteomyelitis. That's a bone infection. We need to stop it getting that far. We need to stop the amputations, and we need to be saving lives, and that is what I'm here to do with the other physicians at the Maria Holder Centre. So please, people, just book an appointment, come and see us. We're a great team, and we're here to help and to fight against diabetes.
We now welcome to the show a patient of the Maria Holder Diabetes Center, Miss Dacia Moore.
Thank you for having me. I have had diabetes for just about 8 years now. I got it when I was really young. I can say it impacted my life pretty big, especially going through school and stuff. It was quite difficult at times.
What did you learn from being a patient of the Maria Holder Diabetes Center?
I learned that diabetes, don't limit yourself. It is not the end of the world, and that you can do everything a quote-unquote normal person can do, and as long as you have a good support system, you'll be okay. I utilize the diabetes specialist nurse, the podiatrist, the nutritionist, and of course the doctor. The staff there, but it is really nice, and they're supportive, and they help me through a lot of my problems. They taught me about calorie counting, learning how to balance my meal so that I can still enjoy the sweet things and everything else that, as I said, quote-unquote normal people can enjoy. They help me not to be insecure about having diabetes. It's something that I have to live with, and to love myself, to be confident in everything I do.
In 2025, the Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening, vascular screening, and podiatry services, offers a standard of diabetic services that equals or surpasses any you might receive internationally at a price that everyone can afford. So if you are diabetic or pre-diabetic and listening to VOB right now, call and make an appointment to get your eye screened for diabetic retinopathy by calling 243-3937. Or if you are having vascular or circulation issues or need to see a podiatrist or nutritionist, call 417-0305. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center. Until next time,
Reach for that extra glass of water. That is the smallest thing that you can do to make the biggest impact on your health.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality. You can do it.